Yeah, I grew up in Boston, Massachusetts, in a part of the city that is called West Roxbury. You know, my mom was a nurse. That definitely influenced my desire to go into medicine. The area of the city that I grew up was like 97% white, 98% Catholic, and 99% Irish. You know, really when I came to Washington, D.C., I realized there is a whole other world out there. Such a more meaningful and rich and enjoyable world than I ever knew as a teenager. And so that was really the beginning of my education. Ended up interning on Capitol Hill for a couple of years, realized that politics wasn't really for me. So I said, let me just take a look at medicine. And I happened to volunteer in a place called La Clínica del Pueblo, which was a free clinic. And I just fell in love with it. I just fell in love with medicine, with community health, with the care of the underserved. I ended up then applying and going to medical school and knew I wanted to do primary care. When I had graduated from medical school, if I hadn't received an NHSC scholarship, I would have had about $300,000 worth of loans. Certain specialties just make more money than others. You know, historically, primary care has not been at the top of that, and still isn't today. I think those market forces would have influenced my decision to choose a specialty, and I will be forever grateful that that was just influenced by my own passion and heart to practice medicine. So I ended up, applying to a lot of different residencies in primary care. I ended up doing my residency training at Yale up in New Haven, and was there for 4 years. Knew a lot of folks in that area and thought, why don't I just look for a place in Connecticut? There were a lot of opioid prescriptions being given out back then. Ended up getting board certified in addiction medicine as well, because I always felt like caring for the underserved, there's so many barriers just to get them into that visit. If I could, with my team of folks, do everything for them that we could and treat them then and there, it really helped define the concept of a medical home a bit more. That, for me, was really rewarding, and I think for them, very therapeutic and beneficial. I credit the NHSC with really being foundational to my career as a physician and my success as a physician, and really helping me to engage the passion that I have had for the underserved. I don't know that I would have been able to engage that as fully if it weren't for the NHSC. After working in health centers for 10 years, I took a job at Center for Medicare and Medicaid as the Chief Medical Officer for Medicaid for the country, and had a year-long experience trying to bring that same mindset to influencing policy that impacts, 80 million people in the country. So I think that that is really what the NHSC can offer. It gave me a really firm base for clinical care. It has informed my advocacy efforts, and I know that it has significantly impacted national and state policies, not because the NHSC has been in the room, but because me as a product of the NHSC has been in the room. And that's been repeated thousands and thousands of times over since NHSC came into being 50 years ago.